Hi, my name is Lyle Murphy, and I'm the founder of the Alternative to Med Center. They generally seek us out for assistance with medication withdrawal. And there's not a lot of information on that out there, especially considering that everyone's a little bit different. So there's no one-size-fits-all protocol for people, and a lot of people need a lot more support with that than they would with, let's say, alcohol withdrawal or drug withdrawal, because it is such a niche application. So let me give you an example of something that would sound like an external thing, but actually a lot of it was internal. So for some strange reason, I was picking her up at the airport. I usually don't do the airport runs, but I must have been in the area, and I didn't have her phone number. And she was an opiate addict and wanted to come off opiates. And so when I got to the airport about 15 minutes late without her phone number, I didn't need a phone to find her. She was this shivering, shaking mess sitting over by the baggage carousel waiting for somebody to get her. And when I showed up, she went from crying to being really excited. And strangely enough, on the way back, there was this like snowstorm this is near Phoenix, right? It was the worst snowstorm I've ever been in. I couldn't see the hood of the car. And she was just having a grand time helping me navigate like the dots on the road, because I could hit the dots and know that I was still on the road. Basically, this woman was transparent to every single emotion that went through the room. She was like a tuning fork. If people were happy, she was happy. If people were stressed, she was stressed. She had no skin between her and other people. So I started doing the intake interview, and this woman had been abused in a way that nearly knocked me off the chair. And it was all I could do to keep composure and be like, wow, okay. To put it short, she started getting abused by her father at the age of 6. By the time she was taken away by CPS at 15, she'd probably had 100 different violations from men that her dad had sold her to. And so me being almost sheet white, I told her, I'm not a trauma therapist. I don't have any therapists here at the time. I just had these supplements. And with these supplements, I might be able to help you get off the opiates because I can build up your endorphin levels. And she said, I've been doing therapy for the last 15 years. And I mean, it helped to some degree, but she still was all over the place. So that was all I had. It was kind of a pure example. It's not like what we have now. We have therapists, we have naturopaths, we have psychiatrists. I mean, it was just kind of me and my supplement bag back then. And we lifted up her endorphins, we got her off the opiates. And in the transition, somewhere she just firmamented, like concrete setting. I mean, she had a limbic nervous system now that wasn't all over the place because we raised her endorphins. So what endorphins do is they not only block pain, but they block the amount of emotion you pick up off another person. It's natural for us to feel the anger of another person, the excitement of another person. They don't need to touch us for us to feel that. We feel it at a distance. What blocks that normal and natural ability of our limbic nervous system to be able to perceive those bonding experiences or those threats is endorphins. So if we're low endorphins, we feel everything, and then we crave opiates. If you're in a situation where you've been traumatized repeatedly, especially as a child, where you think you're going to die, the natural survival mechanism is for you to chip away at those endorphins because you're using them up so that you can perceive those threats more attunedly at a distance. That's where she was at. We raised her endorphin levels, and suddenly she was like giving the most insightful therapeutic guidance to other residents because of all the therapy she'd been through. I mean, she was amazing. And when we graduated her, she was like that prize bunny that, you got the blue ribbon for, and you're just like so proud. But we had to send her home. And obviously her family of origin was not going to be a good placement for her. And her husband actually was abusive, physically abusive, and she had 2 kids. So we're sending her home to the wolves, or we're sending her home to the lions. I mean, it was just going to be a slaughter, and we knew it, right? But there's nothing we could do, So she went home, she took the 2 kids, moved out from the husband, moved in with his parents, and 15 years later, she's been entirely successful. Just from that alone. Now, I'm not saying that people with trauma, that's all they need. But she needed a stable nervous system in order for that other stuff to actually move in a straight line, if you know what I mean. Otherwise, it's like ice is never going to form if the water keeps moving, right? You got to stop the water from moving so the ice will form. Same thing with your nervous system. What you're going to see oftentimes is that the medications have this front-end effect of stabilizing people, and when they go off those medications, they become unstable. So you have these really, really smart people that went to school for many, many years that have this very limited window of what they're seeing with their patients. They're either on meds, maybe they're dealing with some side effects that they don't like, but at least they're staying out of the hospital, or they're coming off those meds and they're very symptomatic and potentially going back to the hospital. But there's really no other avenue for intervention there, you know? It's kind of like the example that they used for decriminalizing drugs in Portugal. Like back in the 50s and the 60s when they had the Skinner boxes, and you only had the opportunity to hit the water or hit the heroin, and you're in a box where there's no other social activity and you're a rat. So basically the rats would just keep hitting the heroin until basically they starved to death or their pups starved to death and wouldn't even drink the water. But these other creative researchers came along and said, wait a minute, rats are social animals. They need to be around other rats, they need to have toys to play with so that they feel like life means something, right? So they gave these rats all these other opportunities to have like social interactions, mating possibilities, toys to play with, and there's nothing that those researchers could do to get the rats addicted to a drug. Even the rats that they put in there that were already addicted, they would voluntarily go through withdrawal in order to become unaddicted because of their environment. So if you take a person and you change the context of their environment, you're giving them the therapy they need, you're putting them into a safe place so they're not being traumatized, you're having them exercise, you're having them eat good foods, take supplements that are really tuned in to build the neurochemistry, then you see things that you're not going to see from a psychiatrist's chair. A psychiatrist is not going to go home with you to see what's in your cupboards. A psychiatrist is not going to go take you to the gym and get you together with a personal trainer. They're not even going to probably ask any questions about these things. And if they do, it's just going to be a little note on their paper somewhere. They're not going to actually create an intervention. When you create interventions on those levels, you see things that they're not going to see. So I think the most important thing for people to understand is that supplements are not a replacement for drugs overall. If you just take a supplement, it may not be an equal replacement for your drug. There's a lot of lifestyle things that you need to change in order for this to work. Your brain cannot live off of Fruit Loops. I mean, life is very creative. Life takes things and does quite magical stuff with it, but there's a limitation of that matter. There's a limitation of what can be done with that matter. If you're not giving the precursors to actually make mental health neurochemicals, your brain is going to suffer to that degree. If your blood sugar's all over the place, your emotions are going to go right along with it, you know? And a lot of people have an addictive biochemistry, either because of their, like with this woman, she may have been geared to have low endorphins in the first place, but her environment totally kicked out her endorphins. You add to that inflammatory foods. Inflammatory foods are going to create inflammation that are going to burn up your endorphins because they're trying to block the pain that you're feeling from the swelling. You've set yourself up into a position where you have a chemistry that is going to crave certain things. Like for instance, artists oftentimes are genetically geared to have low endorphins, which gives them the ability to feel emotions at a distance more pristinely and more intuitively than most people. And they can speak to them and sing to them and poeticize around them. But then they get all of that outside influence of people looking at them and scrutinizing them. They can't endure that. So what is their makeup going to crave? Some exogenous source to shut that down. And this is what we've seen with a lot of our very popular, idols, Michael Jackson, Prince, Whitney Houston. They're geared in a certain way, and there's ways to play with that naturally. So building up a person's endorphins, getting them off the inflammatory foods. Smoking seems to be, probably the arsenic seems to be a toxin to endorphins. Getting a person exercising where they're actually breaking muscle tissue releases endorphins. Having the precursors in their diet or taking it through supplementation to actually build endorphins. These are the kind of things that give them a little bit of advantage over whatever their natural disposition is to conquer and to create balance around their own addictive biochemistry. These addictions, to me, or what people end up on drugs, these are clues. These are very valuable clues, and I don't think it takes Columbo to figure it out. If you're craving benzos, there's a reason. Why are you anxious? What is the real cause of your anxiety? Is it all the time? Because if it's all the time and it's not intermittent, it's probably neurotoxicity. You've probably got something in your nervous system that is skewing the teeter-totter's ability to create homeostasis so that you cannot feel that anxiety. If you're feeling social anxiety, or it's because of your blood sugar, or because you're taking your medications erratically, you're going to see like the person's stable and they're not stable. So it's just a matter of kind of figuring those things out and creating the right application to fix that. And it doesn't necessarily require a drug to do that. In fact, most of the time, it can be done without drugs. Psychiatry has more or less pigeonholed itself into a bad place. And even the prescribers, are not liking more or less where they're at. You've got 15, maybe 30 minutes. If you're working for a facility, if you're working as a private individual, then you can spend 2-3 hours, whatever. But in the conventional mental health facilities, where they're employing doctors as part of a network, they've got 15 to 30 minutes to make a judgment about you and to give a prescription. And that prescription is not going to be, hey, stop taking all the diet pills, ODing on diet pills and like starving yourself, which is causing mental health problems, or stop like taking your mom's prescriptions. It's going to be like, here's a drug. And that's really all they've got. And by and large, these drugs are not sustainable. They may work in the beginning, cocaine will lift your depression in the beginning, but we know where that goes. These drugs are not really that much fundamentally different. They create an effect, but they're not, just like cocaine is not making dopamine, it's not making a reward neurochemical available to your nervous system, it's spending what you have. And when you spend it all, when you spend all the dopamine, the cocaine's not going to do a whole lot. If you've ever seen Scarface, at the end, like a lot of cocaine, still wasn't very happy. The same thing happens with antidepressants, with benzos, with opiates. They're spending, and antipsychotics even, they're spending the natural neurochemistry that you have to create an effect, which is not entirely sustainable. Most rehab places are getting paid to do therapy. And if you're anxious, let's say you've got a genetic disposition where you don't clear mercury that well, and you've got mercury fillings, and the mercury does leach out into your body. Even 1 part per billion can destroy nervous tissue. Well, it also destroys the serotonin pathway. If you have a serotonin pathway that's destroyed, basically what serotonin is not an antidepressant. Serotonin is an anti-impulsivity neurochemical. It's what keeps you from acting on the impulse to commit suicide. So that's why early antidepressants target serotonin, because it might keep somebody from actually acting on their impulses. So when a person's low serotonin, they ruminate. The fight or flight thoughts are around their head. It's like they just keep going in a circle. They're anxious and they can't sleep because serotonin makes melatonin. So if mercury's destroying that pathway, they, again, with the teeter-totter, they can't balance. So they're in this place where they have a very demonstrable profile of being serotonin deficient. You can feed that person tryptophan, which is a precursor to serotonin, but you're still not going to get serotonin because it's poisoned. It's just like if we had carbon monoxide in this room. Carbon monoxide is going to bond tighter to your hemoglobin than the oxygen. There's still oxygen in the room, but if there's enough carbon monoxide in this room, you're going to go into oxygen starvation and die. That's what a toxin does. It outcompetes a naturally occurring substance for a normal physiological pathway. So if mercury is doing that to serotonin, a person's going to be an anxious, ruminating mess, and they're not going to get out of it just by talking about it. They're going to find some relief through drugs, for sure. And drugs are probably appropriate until they can deal with the underlying neurotoxicity. Once they deal with the underlying neurotoxicity, they can come off the drugs a lot easier. But before then, it's going to be a white-knuckling venture, and they're not going to probably be able to maintain it. What we did is we took the practice of environmental medicine and we tried to make it be a residential application. So what environmental medicine does is it's a study of what poisons are out there, how those poisons affect individuals' physiology based on genetic variances called genetic polymorphisms, and more importantly, how to actually clean that stuff up. So, for instance, methylation pathways have a certain expression. Having a inability to clear marijuana, like THC is a fat-soluble compound. You're not just going to pee it out like you do a solvent, let's say. So most people are aware that Native Americans and certain Pacific Islanders cannot clear alcohol. There's a genetic polymorphism called the CYP2E1. So they can't make the conversion from ethanol to aldehyde. So they get drunk really, really, really fast. But it's a solvent, so eventually you're going to pee out a solvent because it's already water soluble. THC is not like that. THC is fat soluble. If it doesn't break down, it's going to build up to psychogenic levels and create, obviously, psychosis. So people that are smoking high concentration marijuana or dabs or even any marijuana at all, depending on their physiology, may have a reaction to that that may be completely different than this other person. So what we're trying to track down is like, and it's very complicated when you ask a question about how much information is really known about this. Well, there might be a lot of information known about what mercury does, or there might be a lot of information known about what THC, at toxic levels does. But when you mix all that together, the interplays between all of them, nobody can really map all that. And so there's two basic kind of categories of toxins. There's metal toxins, heavy metal toxins, non-organic, and then there's organic. And there's ways to clear organic toxins, which is called through biotransformation. When we get over to the other side, I'll show you sort of the processes that deal with that biotransformation, converting the fat-soluble toxin into a water-soluble form so that you can actually excrete it. The metals actually, they mimic minerals, and so they take over the physiological, they fit the valence of what a mineral, it's like a molecular mimicry. They fit the valence, but they don't perform the same physiological function. So metals and organic toxins have different ways that they can be purged out of the system, and usually the more of this stuff that we can liberate from a person's nervous system, the better we can get them back to their baseline of what their, maybe how they're performing when they were younger before they got all plugged up. The trap I see a lot of people getting into is like, I feel a certain way right now, so this is how this is my life. And time and patience and dedication and compassion for yourself can actually go a long way. Like, if there was a time where a person felt normal, there's a way to get back to that, slowly and surely if you do the right things. And usually, one of the more important things is to just try to eat organic. Eating organic foods not only eliminates the toxic stuff that you're taking in, but the phytonutrients and other antioxidants are actually helping unburden you from what you're already getting. So that alone clears up about 80% of the stuff. If a person has chronic anxiety and it's unrelenting and they have mercury fillings, they need to get those mercury fillings removed. It's no joke. The impact that that has on a person's anxiety is, we have definitely trod that ground a lot. You need to get the fillings removed and start, either a gentle chelation program that doesn't involve, chelators, or an IV program that does involve chelators to clear that up. And it will eventually get underneath that. So maybe if you can't afford, what we do here, find an environmental medicine doctor in your area. There's a few different platforms for that. There's ACAM, which is the American College for Advancement in Medicine, and there's also the IMMH, which is an integrative mental health platform, immh.org. Find a practitioner in your area and just start working with them. And if you're not happy with the practitioner you have because they just keep drugging you and drugging you and drugging you, well, first of all, you're probably not alone with that, and second of all, go to one of those databases and try to find a doctor that will actually work with you in a holistic way. Some of these guys can actually apply the integrative stuff along with changing the medications to find a good balance point for people. We started with a group that was centered around orthomolecular psychiatry. Orthomolecular, the Latin derivative of it means, ortho means straight or correct, and molecular means molecules. So it literally means straight or correct chemistry. A fellow by the name of Linus Pauling, who was brilliant enough to win the Nobel Prize twice. Actually, one was for chemistry, the second one was for peace. He coined the term orthomolecular. But even before him, there was a group, Abram Hoffer and Humphrey Osmond, were using niacin and vitamin C, high-dose vitamin and niacin C, for schizophrenics and for people who had overdosed on LSD and things like that, to see what sort of effect these things would have. And they found over a 70% efficacy at keeping people out of the hospital for more than 5 years just using niacin and vitamin C alone. We thought, wow, this is really promising. Now, some of those things in orthomolecular panned out for us, and some of them didn't quite live up to the hype. So the straight supplement thing that we started, in the beginning, I'd say probably had about a 25% efficacy, which, considering the population I had at the time was almost exclusively schizophrenics, that was quite promising. 25% success rate with chronic schizophrenics is like something to really, shoot the fireworks up in the sky, but it's not really enough to say, hey, let's have you mortgage your house and let's see if it goes well. I mean, for some people, they were willing to take take the risk. But we weren't really charging a whole lot. We were charging $5,000 a month for a residential stay. Because we were experimenting with safe and natural, things generally considered safe, but still we really didn't know how well people were going to do. And then we added the detox layer. Then we started getting into the 60 and 70% efficacy. And then by and large, people just needed people to talk to in a therapeutic way, because then the therapy would actually work. I mean, if a person's anxious and can't settle down, how are they going to really use the therapeutic tools and do cognitive stuff? Once we were assisting with that level of their neurochemistry, then the therapy, all the other things, the coaching, working with their families, having open dialogue, all that stuff sort of, came together. So that's kind of the evolutionary track of it. It's not a singular application. Like, if a person's neurotoxic, if I just take him to the gym, and do personal training, are they really going to get better? Probably somewhat better, but are they really going to hit all those angles, right? Strangely enough, in the evolution of this thing, some of the hardest people to wrangle in are actually the professionals, because they're coming from a certain vantage point that's sort of fixed and has a lot of dialogue and dogma around it. So a therapist may think that they need to evaluate for the person and tell them what's wrong with them. A psychiatrist may think that I need a prescription pad. Naturopath may think that, may not have enough awareness about the other things, and may not even have enough awareness about the medications themselves to navigate the withdrawal, and they don't have a license to change any of the medications anyway. But when you bring all those people together, you've got a psychiatrist that can change the medications, you've got a psychologist that actually looks for the truth in another person rather than evaluates for them, and you have a naturopath that can do their thing while the medications are getting changed, it all comes together. And it's not a telephone game with us. We all sit in the room at the same time. We've got we've got the naturopath, the director of nursing, the clinical director, who's also the main therapist, the medical director, and the care manager, who actually plays probably the most important role because they're with the patient the most. They're documenting the patient's treatment plan, they're communicating with the families, and have the information from the families, and sometimes we invite the families into the meeting as well, so we can all talk about what we're seeing at the same time. And that's not a luxury you get in an outpatient office. You just don't have that sort of communication. Even if I'm seeing all those different people, they're not necessarily even willing to work with each other, let alone able to work with each other.
Thank you for watching. Don't forget to subscribe to our channel. For information about Alternative to Med Center, give us a call at 888-984-9667.